Welcome back. My next guest is Dr. Alberto Castellanos, who is a gastroenterologist. Welcome, Dr. Castellanos.
Thank you for having me.
Now, we mentioned we're going to talk a little bit about colon cancer, screening and treatment, which you do both.
Yes.
But what are some symptoms that maybe think, I've got a problem?
Well, unfortunately, although there are symptoms related to having colon cancer, they tend to be unusual and usually only present once the disease is advanced. Having said that, some of those symptoms are bleeding, gastrointestinal bleeding, blood and stool, abdominal pain, cramping, abnormal weight loss. But again, unfortunately, by the time symptoms develop, oftentimes the colon cancer is advanced.
So if you want to prevent a colon cancer, there's some screening methods of which you do a lot of them. Tell us about some.
That's a great question. Going to the issue of colon cancer, one of the things that's important to remember is colon cancer is number 2 cause of cancer death in the United States in men and women. And as opposed to other cancers where we try to do early detection and find it early, colon cancer, we actually have ways of preventing colon cancer. And so while we talk a lot about colon cancer screening, I prefer the term colon cancer screening and prevention. So your question was about colonoscopies.
Colonoscopies and other methods, but colonoscopy is the gold standard, I would guess.
That is correct. Colonoscopies are recommended for average risk individuals beginning at age 50 and every 10 years thereafter.
Okay, now sometimes though, I'll get a report back from a patient that I've sent to have a colonoscopy and they'll end up with a polyp or something else, and they'll say, well, it come back in 3 to 5 years. If it's normal, it's 10 years, but there's variations of when you need to be rescoped.
That is correct. And just to clarify, we classify patients, there are people that are average risk for colon cancer. Those are people that don't have anyone in their family with colon cancer or polyps or other diseases that increase your risk for colon cancer. Those average risk individuals start at age 50. People that are greater than average risk begin at age 40 or 10 years minus their family member's age at time of diagnosis, okay, whichever comes first.
Well, let's talk about the actual procedure, okay, what happens, because the first part's the prep, and that's what the patients always ask me about. Okay, you got to tell about it. So,
well, the procedure itself, most people that have undergone a colonoscopy will tell you that they probably don't remember anything about it. It's usually done with sedation. But the bowel prep they do tend to remember, and I do tell people if it was fun and it tasted good, they'd probably sell it at McDonald's, and they don't for a good reason. But having said that, the bowel preps have improved over the years. It used to be a gallon. Most of the preps we use now are just 3 liters, and we divide it into 2 doses, and it's much better tolerated nowadays.
But it is something that's necessary to get a good look with the colonoscopy.
Absolutely. The colonoscopy is not particularly helpful if somebody's not well prepped. Our ability to see polyps and then remove polyps, which help prevent colon cancer, is affected by the bowel prep. So the cleaner the colon, the better the visualization.
So before we leave colonoscopy to other methods, you actually treat, you said you actually remove the polyp. You prevent the colon cancer right there at the time.
Right. So as opposed to lung cancer, breast cancer, prostate cancer, which are common cancers that we do early detection, colon cancer, not only do we do early detection, but we can do prevention by removing polyps.
All right. There's some other methods to screen for colon cancers. The stool blood test,
yes,
the Cologuard. Do you have a preference, or are they any good?
Well, in terms of prevention, the only test that has been shown to prevent colon cancer is colonoscopy. Now, if we go back to colon cancer screening, colonoscopy is the best test, is the gold standard. It is most likely to detect colon cancer. However, having said that, there are other alternatives. For example, there's detecting blood and stool. That one has about a 50% chance or so of detecting colon cancers. There's newer tests that are based on DNA that is shed from a colon cancer. And if you have a colon cancer, it will detect the colon cancer about 95% of the time, give or take about a 10% false positive rate. Unfortunately, it's not good for finding polyps, which are important to prevent colon cancer. Other tests are sigmoidoscopy, which is kind of like a colonoscopy, except we don't go as far. I kind of liken it a lot to doing a mammogram on one breast. One wouldn't do that, and a sigmoidoscopy would only look at the left colon and does not see the right side of the colon, where most colon cancers are now occurring.
Well, now, one of the things, sometimes we end up doing what the Cologuard is the DNA test that we do. But one of the problems that you have with that, and you might want to comment on, is if it's positive, you're stuck with a colonoscopy anyway?
Absolutely. It's just what we're trying to do is increase colon cancer screening rates by whatever method. And because many individuals will not want to undergo a colonoscopy, this offers an alternative. But you are correct. If you have a positive Cologuard test, it does you no good unless you undergo a colonoscopy to find and diagnose whether you actually have a colon cancer.
Well, just briefly too, not only do you do colonoscopy, but you also look at the stomach. Heartburn's a big thing, and you can look down there and tell us what's going on.
Absolutely. So actually one of the single most common complaint in the gastrointestinal clinic is upper GI discomfort, acid reflux, and heartburn, and it's an incredible burden to society just from a quality of life point of view. And that's evidenced by how frequently acid-suppressing medications are prescribed. It's one of the most prescribed drug classes currently.
Well, that's great information. We thank you for coming in. We'll be right